This is the surgical unit of the hospital. A patient has asked to see a chaplain before going in for surgery. And so I'm going to come along and offer some words of encouragement and say a prayer if necessary.
Come on, Esther.
Often when you're a chaplain, you just have that sense they want to talk. So you go in. And often some of the most richly rewarding conversations are those that are truly spontaneous. You get that sense that they're looking at you and you're looking at them, and they'd like to talk, and you'd like to talk.
Spiritual care helps people find meaning in whatever their circumstance is.
People go into hospital and it begins to bring to mind all the questions of life and death. One, you've got time on your hands. A lot of people, we distract ourselves in our daily lives. We go from thing to thing to distract ourselves. We end up in hospital and suddenly there's time, and all the thoughts about life and death and all that come to mind, especially in that setting.
Hello?
You start to think about bigger questions and your bigger place in the universe, right? That's spiritual. And you start to think about God.
It's very supportive to have someone listen to your story, no matter what it is, if you're a patient or a family member. That's the greatest joy I have, just in hearing the stories, being with people.
We're trying to help people to be as healthy as they can, not only in body and mind, but also in spirit.
The administrations of the hospitals and the staff have come to accept them as truly part of the healthcare team. Not as sort of weird folks who are into religion that happen to be there because somebody might want it.
And they are able to come in and step right in and do stuff with people that normally wouldn't be United or Catholic or Presbyterian, that sort of thing. It didn't matter.
Spiritual care it's inclusive. It's for everybody. It's not to foist anything on someone that they don't want.
So supporting the chaplaincy is something for everyone, because regardless of your current faith background or involvement, we all need to look after our health, and at one time or another we're in a hospital setting and we benefit from that chaplaincy.
We never know what's around the next corner. We could be a patient here tomorrow or later today and may well be in need of or want of the chaplaincy services.
That's probably one of the greatest things that we have in the Grey Bruce, is that we have a chaplain attached to every healthcare team.
The Grey Bruce Chaplaincy Program is different than any other chaplaincy program I've seen, and it's different in a really good way. It's community-based. With our system here, it was the community that asked for it, the community that's put forward a good deal of the funds for it. The hospital then has contributed as well, which we're very grateful that the two can then come together to make this chaplaincy possible.
And that funding means that spiritual care is possible. Without it, we would not have our chaplains.
It really is dependent on an ongoing basis on a donor base. So we need people to say, this is a priority. I want my community to take spiritual care seriously for my own sake, for the sake of others in my community. This is how we grow a healthy community, and I'm willing to put my dollars there to make that happen.
I find that this is a very worthwhile thing. I would hate to be without it. I did work without it a long time ago. And since we've had the support, I do find that our families and our patients are being looked after as a whole.
It's where my passion in ministry meets a deep need and hunger in the world. And so it's great. The two come together and good things happen.
People really want chaplaincy. They want their hospitals to have chaplains. So they're finding ways to creatively move together to make it happen. That's exciting.